All right, welcome back. I hope everyone got a chance to at least get a snack. I know we have a tight timeline today, and I'm about to dive into a topic that's usually about an hour and a half talk. So I'm going to fly through it and hopefully leave some time for questions. And I'll ask the CME folks to keep me on track if I'm rambling on for too long. So I'm Dr. Kelly Dauk. I'm a pediatrician. I'm a native of Louisville. I did my undergrad work at Duke University and then came back to the University of Kentucky for medical school, trained up at Rainbow Babies and Children for my pediatric residency, and then returned to University of Louisville, where I'm a current professor of pediatrics and work for Norton Children's Medical Group as a hospitalist. And so my work in child abuse prevention was sparked by a number of things. Number one, taking care of children who have significant physical injuries, as well as the medical neglect cases that I see in my professional work, as well as the challenges that I faced in raising my own children and trying to come up with what discipline methods I was going to use that would not put my kids at risk for injury or abuse. And it was something that I didn't necessarily learn a whole lot about as a pediatric resident and in my training. And so near and dear to my heart are no-hit zones, which I speak on both locally, regionally, and am on a national committee. And in particular, this topic of corporal punishment, which I think is so important. So I'm gonna just get going here. I have no relevant disclosures. I'm going to talk about the recent trends and policy statements regarding corporal punishment, talk about different justifications that I have encountered in my discussions with families and caregivers associated with corporal punishment, and then talk some about alternatives. And like I said, I think it's challenging to cover all of this material in the short time frame that we have together. So corporal punishment, what are we talking about here? So really, corporal punishment is any punishment in which physical force is intended to cause pain as a means of modifying behavior. And generally, I'm going to be talking about using an open hand on a child's body, but corporal punishment is actually a broader umbrella term that can include standing in painful positions for long periods of time. It can include washing someone's mouth out with soap. It really is a broad term that can be used for a variety of other punishments that we don't necessarily always think of as corporal punishment. And I think this is a really timely topic because we know that in times of increased stress, decreased financial stability, and really a lack of access to regular routine medical care and kids being in schools, that we actually are in a time that's the perfect storm for abuse to happen. So I think this is a particularly timely topic. So how common is spanking? So this study is by Finkelhor et al., and it actually was just published in 2019, looking at the trend in the past year of spanking of 0 to 9-year-olds. And so this was done about every decade, starting in the mid-70s. And what we actually have seen is that spanking has dropped from 77% of 0 to 9-year-olds spanked by report in the past year in 1975 to 2014, where 49% of 0 to 9-year-olds were reportedly spanked in the previous year. And this comes from cross-sectional telephone surveys of a nationally representative sample of US households. So why? Why is this? Maybe it's an increased knowledge of harms. Maybe there's some component of delayed child rearing and generally smaller family size. But suffice it to say that spanking is still common. And so here, this particular graph breaks out the percent spanked in the past year for each age of life. And as we see, spanking rises pretty sharply in the toddler years, but I think it's notable that about 8% of children are reportedly spanked under the age of 1. That's higher actually than what I would have guessed. And the percent spanked sharply increases in the toddler years remains relatively steady until the age of 8, 9 years of age, and then slowly declines, but still in the teen years, we see 10 to 20% of children reporting being spanked in the previous year. There is definitely geographic variability in spanking. In the Northwest and West, there are reduced rates reported, and the highest rates are in the Southern region. Possible explanations that have been proposed is that this mirrors school corporal punishment, and I'll show you some information on that a little bit later in the talk. There are 19 states that still permit school corporal punishment, and regionally they're primarily located in the southeastern part of the United States. This is also a region with a disproportionate population of conservative Christians, and so corporal punishment is a commonly used technique within this group. And so those are some of the proposed explanations for this geographic variability. There is racial variability in spanking, with whites and Hispanics reporting lower rates of spanking than African American populations. And a number of proposed explanations for this. One, perhaps an intergenerational remainder of slavery, or number two, concerns about race-based violence and parents' perceived need for abrupt and immediate control as a contributing factor. Caregiver education and variability in spanking. It appears that a caregiver with a graduate degree tends to spank less than lower levels of educational attainment. Possible explanation may be more exposure to professional opinion and the social science literature. When we look at family structure and spanking, there are actually similar rates of spanking in one-parent versus two-parent households. We do see that one-child families, as opposed to 2 or 3 or 4 or more children families, have lower rates of spanking. Possible explanations include delayed child rearing or more time to find alternatives. And we see that approval for using corporal punishment has declined gradually over the past number of years, but still in 2015, 65% of women and 76% of men believe that children sometimes need a good hard spank. So it still is certainly prevalent within the time that we find ourselves. So school corporal punishment, you can see this map here. The red states are the 19 states that still permit school corporal punishment. And school corporal punishment statistics still would suggest that nationally, there's a disproportionate number of minorities, boys, and children with disabilities in the population that receive corporal punishment as opposed to the school population as a whole. There's the statistics that a child is hit approximately every 30 seconds on average in a US public school, with 4 states accounting for 60% of the corporal punishment reports. And those are Mississippi, Texas, Alabama, and Georgia. I'm going to move more locally to Kentucky. And here you'll see a map, and there's definite geographic variability in our own state, with the highest reports of corporal punishment in our south central, southeastern, by and large, counties. This is from 2016, 2017, so it's a couple of years old, but I think you can see that geographic variability quite well. And in Kentucky, because of the distribution of our African-American population, primarily within Fayette County, Jefferson County, larger cities, our numbers actually do not reflect the usual racial disparity when it comes to school corporal punishment, as do the national numbers. But our numbers do show that those who receive corporal punishment are mostly boys, and are about two-thirds are elementary age students, so our younger students. and certainly a disproportionate number of school children who are on free and reduced lunch, as well as special education students. Thankfully, we have seen a decline in the number of children who receive corporal punishment in Kentucky schools. So the last bar on this graph, 2017, 2018, 284 reports of corporal punishment, whereas just 7 or 8 years prior to that, we had over 1,000. And in Kentucky, it's left up to the local boards of education to establish the guidelines as far as whether or not corporal punishment is used. Here is a Herald Leader report back in 2015 highlighting the 5 school districts that had the highest incidence of corporal punishment, including Bell County, Clinton County, Pulaski County, Pike County, and McCreary County. And we know that nationally, about 1 in 5 students who receive school corporal punishment will report an injury. So that's significant. We also know that corporal punishment is associated with lower academic achievement, lower grades and test scores, lower self-esteem. It evokes anger and fear and interferes with students' feelings of connection to their school community. In 2020, we actually, our legislative session, there was a bill to eliminate school corporal punishment that passed the House, but unfortunately, COVID hit and the bill was unable to be heard in the Senate committee. So a thank you to the many partners across the state, as well as legislators who were helping to move that piece of legislation forward. So when I look as a pediatrician, a medical professional, to the organization American Academy of Pediatrics that puts out the policy statements to help guide my advice to children and families, they're very clear about corporal punishment in schools and have been for the last 20 years, which recommends that state laws abolish all school corporal punishment because of the reasons that I already mentioned, as well as the fact that alternative methods have been shown to be more effective. Additionally, there was a new policy statement in the last couple of years that specifically states that parents should not use corporal punishment, including hitting and spanking, either in anger or as a punishment for a consequence of misbehavior. So this is a much stronger statement than the one that had been in effect since 1998, which essentially had suggested that parents should be encouraged and assisted in developing methods other than spanking, but now the AAP is really quite clear on what's recommended. Similarly, the American Psychological Association essentially makes a call for using alternative forms of discipline. And we're starting to see some traction with this language and a renewed invigoration for this movement. The CDC and their Preventing Child Abuse and Neglect technical package, within their definition of physical abuse, they include the word hitting. And so that is new in terms of what has been included in the terminology for the word physical abuse. I'd like to highlight within this technical package a few areas that are suggested as areas of prevention. So number one is the pink second bar on the left, which suggests that in order to prevent child abuse and neglect, we need to change social norms to support parents and encourage positive parenting. And under this, the bullets include public engagement and enhancement campaigns, as well as legislative approaches to reducing corporal punishment. The CDC also highlights the need to enhance parenting skills to promote healthy child development. So a big focus on home visitation programs. I can't say enough good things about the HANDS program in Kentucky, and this focus on parenting skills and family relationships. And then thirdly, intervening to lessen harms and prevent future risk, which also goes back to behavioral parent training programs. So I'm going to talk a little bit about the research that seems to have the greatest traction with parents and other professionals. And so first of all, who do parents go to as trusted professional sources of advice with regard to child discipline and their use of corporal punishment. And so what we find is that pediatricians are the #1 source of professional advice, followed by religious leaders, as well as mental health professionals. And so I'm going to share a couple of studies that I think are really meaningful and strike a chord with parents. The first is this study that suggests that spanking actually shrinks parts of the brain. And so kids who are spanked once a month have 14 to 19% smaller brains in the decision-making areas. And what I'm talking about is the prefrontal cortex. So this is the area of the brain that's responsible for impulse control, executive functioning, the ability to make good decisions and judgment, being able to correct and modify behavior, and being able to infer what others are thinking and feeling. And so we really rely on this area for higher cognitive function. And so again, this research really resonates with parents. I'll also talk about an association between spanking and IQ points, so cognitive function. And so we find that American children who are spanked at the younger age of age 2 to 4 have five less IQ points than kids who were not spanked. And spanking that occurs between the age of 5 and 9 tend to have almost 3 fewer IQ points when they are tested again later than non-spanked children. If you want to read sort of the guru, the largest meta-analysis that pulls all the data from all the studies, that would be by Liz Gershoff. And the strongest relationship that you will see with regard to this data is the relationship between corporal punishment and physical abuse. And so that does not mean that every child who received corporal punishment is abused, right? That is not the case, but there is a very strong relationship. And so we, as those who work with children and families, want to reduce things that could potentially cause harm. And we see actually the relationship not just between corporal punishment and physical abuse, but also this association between corporal punishment and lots of other negative health outcomes. So increased aggression, antisocial behavior, mental health problems, lower self-esteem, et cetera, et cetera, et cetera. And so again, I think that all of us would agree we want to recommend things that will reduce the risk for the children that we care for in terms of these negative health outcomes. So I'm going to jump now to some common justifications that I hear for the use of corporal punishment and talk about those a bit. So #1 is I would never abuse or injure my child, right? #2, I was spanked and turned out fine. #3, spare the rod, spoil the child. So the religious aspects of corporal punishment. So under this, I would never abuse or injure my child. So this shows a continuum, right? All the way from slight shoving to mild bruising to outright broken bones and definite injuries. And so most states permit parental rights to use corporal punishment, but the language gets a bit tricky because most of the statutes include words like as long as it's reasonable and not excessive. And Kentucky statute in particular prohibits corporal punishment, which is, quote, designed to cause or known to create a substantial risk of causing death, serious physical injury, or disfigurement, extreme pain, or extreme mental illness. And so this is really where we kind of get into a gray zone with no agreed upon point where corporal punishment crosses that line to abuse. In the medical community, we typically have relied on the presence of injury or the risk of injury in terms of identifying children who need protection. But we know that typically violence toward children doesn't occur in a vacuum. And oftentimes households have a history of intimate partner violence, when child maltreatment is reported, about 55% of US households actually have a history of intimate partner violence. So these things, again, don't occur in a silo. And it's interesting, if we think about this continuum, it's not debated for adults, right? It's not okay for my husband to, mildly slap or shove me, right? By using corporal punishment, it can be argued that we're teaching children that adults who love them and care about them are permitted to hit them. And then how does this play out when kids become adults and are entering into these adult love interest relationships? So this is another slide that actually is from Stacy LeBlanc, who's a colleague and a dear friend who does a lot of no hit zone work. And so this shows the association between corporal punishment and, again, all of these negative health outcomes. And you'll see that the largest, greatest green bar association is with kids being a victim of physical abuse. And then that's a picture of Liz Gershoff up in the upper left-hand corner. So thanks to Stacy for allowing me to use this slide. And so we've changed quite a bit in terms of our thinking over time. Pardon me, some further evidence and research for you. This is a Canadian study, and this is a really important study which looked at the substantiated cases of maltreatment and found that in over 75% of those cases, the incident started out as an episode of physical punishment. And so I truly don't believe that when parents set out to correct behavior and choose to use corporal punishment, that they are thinking, I'm going to abuse my child. But under the circumstances where things escalate quickly, and I think that there is the opportunity when you're using violence or hitting for things to escalate and get out of control to where that line is crossed. Another Canadian study which suggests that children who were spanked by parents were 7 times more likely to be assaulted, so meaning kicked, punched, etc. And a US study that showed that infants, again, we're talking about children who are less than 1 year of age who were spanked in the previous month, were over 2 times likely risk of injury requiring medical attention. Spanking increases the odds of physical abuse by over 3 times, and spanking with an object in particular increases the odds of physical abuse by over 9 times the risk. And so in this study, in the child maltreatment, I really think this quote speaks volumes. Social norms regarding physical discipline may be the most prevalent risk factor for child abuse in the United States. And so while we hear this justification, I would never abuse/injure my child, I think that we have good evidence that indeed that does happen at times. And so you don't think it'll happen to you until unfortunately, we see too many incidences where that is what happens. And so we've changed a lot in our thinking about what to do over the years. And you can probably figure out pretty quickly where I stand on this issue. But just as we, don't smoke in restaurants anymore, and we always wear our seatbelt and we put our babies to back on our sleep, our thinking about this particular issue perhaps needs to change. And I think we're seeing some evidence that it is changing. Okay, so I was spanked and turned out fine. Anyone ever heard this as a justification? I suspect you may have. I know I have for sure. So again, we slept on our bellies. We all rode in the back of a pickup truck, right? Some of you may even be old enough to remember the smoking section on the airplane. But at this point, that is not what we recommend to our patients and families, because research has shown us that that is not the safest way, and we want to reduce the risk of harm, right? So we now know the dangers of spanking and must recommend a different way. Hopefully, most of you have heard of the ACEs study, so the Adverse Childhood Experiences study. And the article of the year for child abuse and neglect is this article in 2017 that suggests that spanking be considered an ACE. And again, the adverse childhood experiences study, just to give you a brief background if you've not heard of it, is a study by Drs. Folletti and Anda, and essentially research that showed 10 different categories of adverse childhood experiences that showed up later in terms of the adoption of health risk factors, and then ultimately led to disease and early death. In terms of spanking as a category of ACE, there is a significant association between spanking and increased suicide attempts, an increased rate of alcoholism, increased substance abuse, and this was when researchers controlled for physical and emotional abuse. We'll move on now to the religious aspects, and perhaps you've heard the justification, spare the rod, spoil the child. If you want to read on this particular aspect of corporal punishment, I highly recommend that you look up Victor Veith. He's widely published and is really an expert in this area. And you will see this graph on the left that shows the percentage who agree that spanking is acceptable by religion. And it compares a group of born-again Christians, primarily conservative evangelical Christian groups who believe that the Bible demands corporal punishment, against the blue line, which shows the other groups of Christians. In particular, I find this working with Molly, a culturally sensitive approach to parents using corporal punishment because of their religious beliefs, to be a fantastic and brief article that I think can give you a lot of background. And if you are encountering a family who uses corporal punishment aligned with their religious beliefs, I can't recommend it enough. And there's another piece from Sticks to Flowers written by Victor Veith. And really, he stresses that discussing this with patients and families requires a culturally sensitive approach. And so these conservative evangelical Christian groups really feel like any dismissive approach to scripture is really a very slippery slope. And so you actually won't see that exact verse in the Bible, spare the rod, spoil the child, but it typically refers to this verse in Proverbs that says, those who spare the rod hate their children, but those who love them are diligent to discipline them. And so when you think about the rod, and when before I did more reading and learning about what this verse refers to, I always thought of the rod as the stick part of the shepherd's staff, and presumably to use that rod to hit someone as punishment. But actually, when you look at the rod, it's quite misinterpreted if you take on what I just discussed. The rod actually is the curly end of the staff, and the rod is actually used to pull the sheep out of dangerous or unfortunate situations and bring them back to the group. So if a sheep was stuck in brush or had fallen into deep water, the shepherd would then use that curly end of the rod to bring them back. And so in this way, it's thought that the rod is really a symbol of God's protection. And in fact, the word musar, which is commonly found with rod, there are multiple different interpretations of that or definitions of that word, including stick, scepter, lance, spear, or the idea of physical or oral reproof and knowledge to be mastered. And so certainly rod or musar can mean physical punishment. It can also mean verbal correction, that oral reproof, or information to be mastered. And so choosing an alternative does not mean necessarily that there is a dismissive, that folks are being dismissive of the scripture. So certainly scripture authorizes, but does not demand the use of physical punishment. And what's interesting is that there's lots of scripture that discusses corporal punishment of adults, and yet corporal punishment is not used within these Christian groups or in the society at large, right? We don't flog adults for transgressions. And so when we're thinking about kids, then perhaps there can be alternative interpretations of scripture as well. And really the modern concept of spanking is not found in the Bible at all. When you look for different verses, it is much more significant physical punishment. It's not a light slap on the bottom with a hand. It's much more severe forms of physical punishment that are found in the Bible. And so again, choosing an alternative does not equate to being dismissive of the scripture. So in summary, spanking shrinks brains, spanking lowers IQ, spanking is associated with a myriad of negative health outcomes, spanking significantly increases the risk of physical abuse, and spanking can be considered an ACE. And alternatives to spanking are consistent with scripture. I'm going to shift gears a little bit. Here's a number of articles making headlines that talk about corporal punishment and spanking. I mean, article after article after article after article. Okay. And so I'm going to switch gears then and start to talk about alternatives briefly. Again, I think this could be, you know, a 2-hour lecture in and of itself. And what I want to be really clear about is that no hitting does not mean no discipline, right? And we need to be really clear in our discussions with families on this issue. I think we need to be really frank that parenting is hard. Goodness knows it is the hardest thing that I have personally ever done. It's way harder than going to medical school. It's way harder than being a physician in the work that I do in the hospital. Parenting is hard. And we all need tools in our toolbox to raise healthy children and healthy families. And so again, no hitting does not mean no discipline. Discipline, the real root of that word, means to teach. And certainly parents are their child's first and greatest teacher. Where I find the biggest challenges is that in the families that I've taken care of over the years, is that there is a mismatch between the child's level of development and the expectations of the caregiver. And so I think as much teaching and talking as we can do with families that we care for to help them have appropriate expectations, the better the relationship is going to be. And we have to start those conversations really early, even prenatally, thinking about child development and going ahead and talking about what discipline methods are acceptable and unacceptable. If you'll recall, infants, at least 8% report being spanked in the prior year. So we can't start having this conversation at the 15-month-old, at the 15-month-old well child checkup. So the foundations of discipline: consistency. If you're going to say no to something, it has to be a no. It can't be no until the child whines and cries and fusses enough that it then becomes a yes, because that teaches that whining and crying and fussing, if you do it long enough and at a significant enough level of distress, that it gets you what you want. Follow through. So again, that no has to be a no. I think that and consistency go hand in hand. Caregiver agreement. So if the rules are different at mom's house than they are at grandma's house, than they are at dad's house, than they are at the babysitter's house, it's really confusing for the child. And so trying to have agreement about what the rules are is a real key. Eye contact and touch. So I know if I holler at my kids to get their shoes on from the kitchen and they're sitting in the living room, how successful is that request, right? Get your shoes on, right? It's much less successful than if I go to my child, I get down on their level, I look in their eyes and I let them know, we're about to leave in 5 minutes. It's really important that you get your shoes on now, right? You'll get a much different response. Rescuing. So if I'm trying to teach my child that they need to be responsible and take their lunch to school each day, or make sure that they get their school supplies organized and into their backpack, I have to be okay with knowing that if I see their lunch on the table and they've already gone to school, or I see their homework sitting on their desk after they've already gone to school, I have to be okay with leaving it there and not then going and bringing it to them and rescuing them. I think we talked about age-appropriate expectations already. I'll stress family meals. I hope that some people are getting to have family meals these days. Perhaps that is the silver lining of COVID, is that we all have more time together. But I know that there have definitely been periods in my family's life where having a family meal is incredibly difficult. But setting aside that time to truly sit as a family, and I'm not talking about sit as a family and sit there all of us looking on our phones and having the TV on in the background, but truly spending time together and having discussions and building those connections. I love this particular brochure by the Prevent Child Abuse Kentucky. It is downloadable for free, and I would highly encourage you to go to their website, PCAKY, and look at it. I think it's exceptional in terms of talking about the stage of development and putting it into the context of appropriate considerations with regard to discipline. So let's talk a little bit about discipline for different age groups. So discipline for infants. So number one, plan ahead. So again, we need to start talking to children and families about learning about normal development and considering discipline tools in advance. We can't start talking about this once the kid is 12 months, 15 months, 18 months. Parents learning as much as they can about normal development is super important. And again, those who work in parenting development programs and the HANDS program, I think do just a fantastic job of helping to encourage this. So babies learn by modeling, right? And it's incredible how advanced their receptive language is before they can even talk. So they can tell, even by the tone in our voice, whether we're happy, mad, sad, that sort of thing. And they pick up on these sorts of things. And so they pick up on, if I respond to a situation by hitting, then what do they learn to do when they're frustrated? Well, they hit, right? Distraction. So kids really don't have a lot of object permanence. And so rather than continually reprimanding little ones for bothering dangerous objects, it's incredibly effective to just take that dangerous object out of their hand and put a new object that they are much more interested in, particularly ones that make music and have lights, or just to move spaces entirely and trying to have a space that is infant and toddler quote proofed, if you will. Now that is never to suggest that you can take your eyes off them though. Coping with crying. So I can't highlight this enough. If you as a caregiver or families you know are feeling frustrated because crying happens, and it can happen for hours on end, and it doesn't even necessarily mean that there's something wrong. But it is okay to put that baby into their safe sleep space, the one that we heard about in a lecture this morning, and to step away and call someone for help. And so normalizing crying and normalizing frustration for parents and encouraging them to do the things they need to do to prevent that frustration from spilling over into a dangerous situation for kids, I think is just so important. So toddler discipline. So trying to create spaces in the home where toddlers are going to be successful, right? Where there are toys for them, where it's not, you know, the china on the coffee table situation, so that they are less likely to find themselves in situations where you're saying no. Trying to say no sparingly and having just a few consistent safety-related rules, right? So although opening and closing the door 49 times is annoying, it doesn't necessarily have to be no. But taking the fork and putting it in an outlet, well, that has to be a no, right? And so if you say no all the time, it starts to really not mean much in a child's life. Timeout. So depending on the professional experience of the person you're talking to, some people love timeout and some people really don't find timeout to be particularly effective. At my house, I know that timeout was most effective if I made it about the object that was causing the difficult situation. And so anytime I could make it about, oh, well, if you all are going to fight about that toy, well, then the toy needs to go into timeout because it's causing problems. And so that you may find that as an effective tool. Providing two choices and picking choices that are both acceptable. So do you want to hop to bed or do you want to skip to bed? Right? So you're still getting to bed, but providing that toddler with a choice sometimes can ward off meltdowns and challenges. Time in, and I mean time in, again, where the phone is not in the caregiver's face, but true time in and play with the toddler, and developing those bonds with the toddler are so important. Catching them being good and that positive reinforcement. I love how you went and put on your shoes the first time I asked, or, oh gosh, I love how you're treating baby doll so nicely and being careful that she doesn't fall down. Sometimes there can be utility in ignoring. So perhaps this falls back on having a few consistent rules and only saying no so many times, but sometimes ignoring the behavior is the way to go. Being able to anticipate meltdowns and tantrums. So perhaps scheduling the doctor's appointment at 1:30, you know, is kind of pushing it because nap time's usually around 2. But if you can bring a favorite book and a snack, then you can make it more of a setup for success for the child. And then trying to name feelings, because it takes a while for toddlers to really grasp the nuances in language and match those with how they're feeling. School age discipline. So house rules and consequences. I think this is a great idea, honestly, to sit down with kids at the kitchen table and talk about what the rules are going to be. And when they can have input on what the rules are, they really actually do a great job of coming up with what the basics should be. And honestly, at my house anyway, they come up with consequences that are probably much worse than what I would have necessarily come up with. But allow them to have some ownership and some say in what the rules should be and what violations of those rules means. Natural consequences. Well, if you keep throwing that toy and it breaks, then the toy doesn't work anymore, right? Time in is still so important, and not media, and again, not having that phone. Continue to catch them being good and giving them positive attention. We can't have our kids in front of TV and media all the time. We need to be out playing with them and paying attention to them. And then modeling conflict resolution. So if my husband and I are frustrated with one another, allowing them to hear us talk it out and show that that's the way to solve problems, not hitting or screaming or those sorts of things. Tween and teen discipline. So again, house rules and consequences, we already kind of talked about that. Definite limits to online time, particularly access to Wi-Fi and that sort of thing. It is definitely a reasonable idea to have a certain time after which the Wi-Fi shuts off. Time in and parent timeout can be really effective. So another thing that I didn't mention earlier when I talked about timeout of objects is timeout for the parent can be a great strategy. So you know what? I really need to think about this and I can feel myself getting angry and frustrated and I just need a minute. And modeling that to kids as an effective way to gather themselves and be able to then come back to the situation and handle it in a better way. Encouraging positive choices. So, wow, you know, I saw some people at the football game and it looked like they were kind of sneaking behind the stands to smoke. And I noticed that you didn't take part in that. I think that was a really good choice. Having a code word for safety, because above all, we want our teens to be safe. And so if they find themselves in a situation where they are not safe, having a word that they can text to you that means you're going to call them and tell them they have to come home because of a family emergency can be a really effective tool for keeping them out of trouble. And again, modeling conflict resolution. So I will, I need to wrap up, but I will draw your attention. I'm on a no-hit zone national committee. that has developed some tip sheets through APSAC, the American Professional Society on the Abuse of Children. It provides a pledge for parents to make their homes no-hit zones. And a no-hit zone is really an environment in which there is no hitting, period. So an environment in which no adult shall hit another adult, no adult shall hit a child, no child shall hit an adult, and no child shall hit another child. I'd invite you to take a look at the materials on www.nohitzone.com. If your organization would like to become a no-hit zone, I would be delighted to train all of you in what that means. We have a no-hit zone at Norton Children's Hospital and in our Norton Children's Hospital Medical Associates offices in Louisville. And these are some of the materials if you've been in any of our buildings that you may have seen. And we actually, our Jefferson County Clerk Family Court Office is a no-hit zone. And this is something that's gaining a lot of ground nationally. There are city buildings in Staunton, Wisconsin that are no-hit zones. There is a church that's a no-hit zone. The child advocacy centers in Florida are becoming no-hit zones. Schools in Louisiana are becoming no-hit zones. And gosh, what a world it would be if every Target and Walmart were a no-hit zone. But here's the members of the committee. And if there's maybe one question, I'd be happy to entertain it, but I'm over time. No questions. Can we advocate to make a business a no-hit zone? Absolutely. Talk to me offline. I will hook you up. Okay. Well, if there are not any questions, I'll thank you for your attention.